webinar tonight. So I'm going to kick off by giving a bit of background on inflammation, and for those of you who don't really sort of know in detail what inflammation it is and how it affects us. Inflammation, if we put it very simply, is the normal response of tissue to injury, and this injury can be anything from infection to trauma or to sort of invasion from pathogens such as bacteria or viruses. The inflammatory response has to be very tightly regulated. The inflammatory response consists of an initiating factor, but it's important that once this initiating factor has happened and the inflammatory response has occurred, that the body then goes back to normal. And it's when the inflammatory response continues unnecessarily that this leads to further damage and the increased risk of disease and poor health. So we can classify inflammation as either acute or chronic, and it's the initial response of the body. This acute inflammation is the response to harmful stimuli, which is then followed by this sort of cascade of biochemical events that then further matures the response. The inflammatory response is then followed by a series of downplaying signals which halt the process once the immune sort of crisis is over. And so if we have poorly regulated or prolonged or inappropriate inflammation, such as chronic inflammation, which is also called silent inflammation, this is what increases our susceptibility to illness and disease. The cells, there are so many cells that are involved in the immune system, and this slide is really just to sort of give you an indication of how many different cells there are, and they're highly complex. They all have different functions. So we start off here with our sort of stem cell. This differentiates and gives rise to a series of subset of cells, which in turn further differentiate, and so on. So there's an awful lot of cells. And in order for them to be able to respond appropriately, they have to be able to communicate with each other within the body. And they do this by a series of products that they release to each other. And so you can see there are many different types of cells. They all have different functions. They all have different receptors, and they all give rise to sort of end products that are all involved in this sort of communication process. And just as a sort of small example of a few of the chemical substances that are released during the inflammatory response, we have histamine, for example, released by mast cells. This is sort of classic response during allergy, for example. Histamine gives you that sort of itching response to allergy. We have plasma proteins, we have C-reactive protein, and CRP is actually one of the sort of classical inflammatory markers that we look for when we are attempting to measure the amount of inflammation in the body, or whether somebody actually is sort of highly inflamed. But the chemical mediators that we really are sort of concentrating on talking about tonight are a family of proteins called cytokines, and it's these cytokines that regulate and mediate the immune response. And again, the cytokines is a terminology for a family of products. So within that family, we have interleukins, we have lymphokines, various different cell signaling molecules. Some are involved in turning on the inflammatory response, others are involved in downplaying the inflammatory response. And there are many hundred cytokines. They act independently, and they act synergistically with other cytokines. So there's this cross-talking that's going on. Many actions of cytokines, as we can see listed here. So we know the cytokines are linked to inflammation, and the key to regulating cytokine production and the amount of inflammatory or anti-inflammatory products and the subsequent inflammatory process is through modulation of a group of hormones called eicosanoids. We have a subset called pro-inflammatory eicosanoids, which drive the immune system and the inflammatory response, and we have the anti-inflammatory eicosanoids that then sort of step in and help to end the process. It's the overproduction of these pro-inflammatory products or the reduced production of anti-inflammatory products that results in this continued production of inflammatory products, which is the hallmark of silent inflammation. And so within the eicosanoids, we have leukotrienes involved heavily in immunity, immune function, a huge role in allergies and asthma, for example. We have thromboxanes, which are involved in cardiovascular function, so sort of constriction and dilation of blood vessels, and involved in blood clotting. And possibly one of the most important, and certainly sort of the focus again of this talk, is the prostaglandins. And it's the prostaglandins that are key players in inflammation. So they are involved in dilation of muscle cells, they involved in blood clotting again, they regulate inflammation, they control hormone, but they're also important in controlling cell growth, division, and cell death. So the prostaglandins are also sort of very heavily involved in sort of cancer, for example, cancer progression. And because of the different types of eicosanoids that I've just sort of talked about very briefly, so we're sort of touching on cardiovascular, we're touching on immune function, and we're touching on inflammation, we can start to see why sort of chronic inflammation is the sort of key underlying factor to many, many, many different conditions. So many of us would sort of associate inflammation with your sort of obvious things like pancreatitis, rheumatoid arthritis, irritable bowel. But what a lot of people aren't aware of is that inflammation actually plays a key role in mental health disorders, for example, and even sort of neurological disorders, so neurodevelopmental disorders, Alzheimer's, and those sort of areas as well. The good news is that we can actually regulate eicosanoids because eicosanoids are derived from a group of polyunsaturated fats, the omega-6 and the omega-3 families of long-chain polyunsaturates. And it's the ratio of omega-6 to omega-3 in the diet that actually influences the type of eicosanoids produced. So if we can change the ratio of omega-6 to omega-3, then we're set in our ways to being able to regulate inflammation. So I'm just going to talk a little bit about the metabolism of essential fatty acids. Some people may have heard me talk about this before, so it might just be a quick reminder. But if we look at what we call the essential fatty acids, and if we look at the omega-6 family and the omega-3 family, they are both derived essentially from plant-sourced oils. So just as a small example, omega-6 are predominantly found in things like sunflower oil, omega-3 family found predominantly in flaxseed oil. Once we consume these omega-3 and omega-6, the body then has the chemical machinery, if you like, to modify them and start to elongate them into longer chain fatty acids. The first enzyme that is involved in this process is called delta-6 desaturase. In humans, unfortunately, we're not very, or this enzyme is said to be rate limiting, so we're not very efficient at this very first step of converting omega-6 LA to GLA and omega-3 ALA to SDA. There are many inhibitors of delta-6, such as poor micronutrient status. We need lots of cofactors. Water-soluble vitamins and minerals are key players as cofactors for delta-6. Saturated fat intake, so if you have a high intake of saturated fat, this can limit the activity of delta-6. Various genetic polymorphisms, so we're all a little bit different. Some people may have genes that code for a fast metabolizing delta-6 desaturase, others may have a slow metabolizing enzyme. If we look at diet, things like caffeine, alcohol, anybody who's on statins, for example, will also have a lower delta-6 desaturase activity. But if we can get past this step, we can convert through to GLA and SDA. And then from there, the next step becomes a little bit easier. Another enzyme, delta 5 desaturate, then converts to DGLA and on the omega-3 EPA. And then there's another step, DGLA to AA and EPA to DAA. And the reason that these 4 fatty acids are highlighted here is because these are considered to be the long-chain fatty acids. These are your short-chain fatty acids. And it's these long-chain fatty acids that are key players, because these are the omega-3s that are converted into hormone-like substances. So DGLA, AA, and EPA convert to eicosanoids, as we've discussed. DHA is a little bit unique. It's not in the same sort of pot as these 3, but it does convert to its own series of anti-inflammatory products, or anti-inflammatory products called docosanoids. The issue with the type of eicosanoids that are produced from these fats is the ratio of LA and ALA that is in our diet. So because they compete for the same enzymes, whichever family dominates in the diet is going to hog these enzymes and will convert more efficiently through. And what we find is that the omega-6 family at this point here can either convert through to anti-inflammatory eicosanoids alongside EPA, your omega-3, or when there is not enough omega-3 in the diet, this enzyme delta 5 favors this side rather than the omega-3 side, and it converts to arachidonic acid, which, if in excess, can become the issue when we're talking about inflammation. So omega-6 arachidonic acid shoots off in this pathway known as the arachidonic cascade, and it produces inflammatory prostaglandins, inflammatory leukotrienes, and inflammatory thromboxanes that far outweigh the anti-inflammatory products from EPA and DGLA. So we're starting to sort of see how omega-6, omega-3, and the ratios of those two in the diet can influence inflammation. So we've talked about omega-6 and omega-3, and for many years, this sort of expression of omega-6 to omega-3 ratio was used to express, I guess, sort of our health status when it came to the production of many of the byproducts. But it's more in recent years that we've started understanding that the omega-6 to omega-3 ratio isn't actually that truly representative. And the reason for this is that when we calculate the omega-6 to omega-3 ratio, we add up all the omega-6 on one side and express it as a ratio to all the omega-3 on the other side. But these individual fats have very, very different functions. And if we're really concentrating on long-chain fats, and especially when we consider that it's actually arachidonic acid and EPA that are the main players when it comes to producing inflammatory or anti-inflammatory products, that it's actually arachidonic acid to EPA ratio that is a direct measure of inflammation in the body. So we're starting to go away from defining something as the omega-6 to omega-3 ratio, and if you look in the sort of scientific literature, we're seeing a lot more reference to arachidonic acid EPA ratio. So that's kind of set a little bit of background about inflammation, and we know that inflammation is sort of a key player in a lot of conditions, but why is it that we are actually so inflamed in the first place? And one of the reasons is our diets have changed, and in order to just explore this very briefly, we have to go back a few years and we look at the type of fat that our ancestors, for example, our hunter-gatherer ancestors were eating, and they actually survived on a very balanced ratio of omega-6 to omega-3. Since the introduction of agriculture, our intake of omega-6 has shot up, and our intake of omega-3 has sort of plummeted. So this ratio is pretty much out of balance. And certainly changes in the last century and most definitely in the last couple of decades have really accelerated this process. We consume lots of foods that are heavily refined, foods that are highly processed, and we consume many different types of food that are really sort of there for convenience sake. But with convenience there comes consequences, and it's the changes in the very basic foods that have led to resulting in loss of minerals and vitamins, but certainly in the type of essential fats that are actually in our diets and in the foods that we eat. And it's the refined, heavily processed foods that are now making up the bulk of our Western diets. And in fact, if we start looking at some of the very highly refined, heavily processed foods, they're sort of being defined as empty calories, very little or no nutritional value. And I mean, it's not just sort of necessarily the type of fats that have changed, but it's the whole sort of the type of protein that we're eating, the lack of vitamins and minerals, and altogether, it's basically having a detrimental effect on many of the physiological and metabolic processes. And so basically this concept that our diets are evolving at such a rapid rate that our sort of genetic composition cannot literally cope with it. And so we have a lovely little diagram here. So pre-agriculture, we had a nice balanced production of fatty acid metabolites. And so we have sort of a whole body homeostasis. Post-agriculture, ratio has changed very heavily in the favour of omega-6, and this has led to possible health consequences. But remembering that it's really the AA to EPA ratio that provides a much more accurate biomarker for inflammation, because it's only really AA and EPA. There's the competition between these two long-chain fats and the eicosanoid end products that they produce that are involved in the inflammatory process. And in fact, the arachidonic acid to EPA ratio now well documented as a measure of silent inflammation, and there's a little table here that helps us to sort of express the ratio in regards to the inflammatory state and how this actually affects our sort of general health, if you like. And if you go onto any sort of scientific website listing sort of various papers that have been produced on these conditions, you will find that a high arachidonic acid to EPA ratio is expressed in many different types of conditions. So anything from depression to Alzheimer's to basic skin conditions. So we know that, but if we can modulate this arachidonic acid EPA ratio, we can actually improve inflammation, and we can improve some of the symptoms that are related to some of these conditions. We know that the arachidonic acid and EPA contents of cell membranes can be altered through consumption of pure EPA. Increasing EPA results in a change in the production of the eicosanoids produced by the body. Changing the fatty acid composition of our immune cells affects immune function and pathways that include things like changes in the membrane structure, changes in the way that cells actually communicate with each other, so cell signaling, but even down to sort of the gene level. So how gene expression of cells and the products that are involved in the inflammatory cascade. The message that we need to increase omega-3 levels is certainly not new. Government currently are sort of recognizing that we may need to be increasing our omega-3s. Recommendations are set at just under 0.5 gram a day, and these levels are really sort of advised for people to sort of maintain good health. So these are not sort of therapeutic doses that we're being advised to eat. 0.5 gram of long-chain omega-3 can be achieved by eating 2 portions of fish per week. Recommendations are that one of these should be oily. So long-chain omega-3s in oily fish are going to be much higher than sort of white fish such as cod that store their omega-3s in their livers, for example. if you look at the UK as a whole, we're not an oily fish loving nation, and our actual intake is about half of the current recommendations. For those individuals who are non-fish eaters, they are achieving around 50 milligrams of long chain intake a day. Now, the other issue is that people say, well, I'll just increase my fish intake and that will deliver the long chain fatty acids that I need. So whilst on one hand we're being advised we should be consuming 2 portions of oily fish, or one white, one oily a week, we're also getting sort of recommendations that certainly women and children of child or women of childbearing age shouldn't consume more than 2 portions a week because of issues with contamination. So if we look at issues with methyl mercury dioxins and PCBs, certainly with larger, longer living fish, there are sort of issues with how much fish we can actually be consuming. And so this is sort of brings us around to the idea that consuming fish oil may be an alternative to consuming fish, and certainly a way of delivering possibly the higher sort of amounts of omega-3 that might be needed to achieve a therapeutic outcome. And if we very briefly look at how we've progressed, the whole sort of fish oil industry has made huge leaps and bounds, certainly in the last 10 years. And going back to sort of 50 years ago when we were sort of being given cod liver oil and known for its sort of health benefits, we've moved on there to sort of start extracting omega-3 from fish body oil. This has then sort of led to the sort of concentrating omega-3s and the sort of clarification that within fish oil there are actually 2 types of omega-3. Omega-3 just sort of actually referring to the family name rather than the individual long-chain fatty acids EPA and DHA. And since then, we've started realizing that EPA and DHA actually are very different types of fat with very different functions within the body. And recently, EPA as an isolate on its own is certainly being recognized as a major anti-inflammatory agent. And if we look at the amount of EPA that is in general supplements, if we go back to sort of talking about cod liver oil and standard fish body oils, because the long chain fats in these 2 types of fish oil are actually in a triglyceride form, then the amount of EPA in 1 gram of either cod liver oil or standard fish body is going to be at about 180 milligrams. So in order to deliver 1 gram of EPA, you'd need to consume 6 grams of each of these. And given that the majority of capsules are about 500 milligrams, you'd need about 12 capsules. So that's a lot of capsules to deliver 1 gram of EPA. Some products concentrate omega-3 fatty acids, so that sort of brings the numbers down a little bit, but it's really sort of down the end here where we start looking at ethyl EPA concentrate. So you're basically removing DHA, you're moving all the sort of fatty acids that you're not particularly interested in, and encapsulating EPA on its own. And so 1 gram of EPA can actually be delivered by anywhere between sort of 2 and 4 capsules, depending on the size of the capsule. And ethyl EPA supplements are actually now again being recognized as a very convenient way of providing the body with therapeutic levels that might not be possible just through diet alone. EPA supplements offer the concentration, the purity, and the safety that is needed when we're sort of supplementing with long-chain fats. And pure EPA is okay on its own, but we don't want to sort of swing the omega-6 omega-3 ratio out of sync. So after a certain time, it's quite advisable to add GLA as an anti-inflammatory omega-6, which will then shuttle the omega-6 pathway down an anti-inflammatory route. So, and on that, I'm now going to sort of summarize by saying, you know, as a nutraceutical company, we're very focused around sort of non-drug alternatives, and certainly, as Hippocrates said, if you can leave your drugs in the chemist pot and heal the patient with food, then so be it. I'm going to hand back over to Sophie now, and she's going to give us a little bit of evidence behind EPA in the treatment of inflammatory conditions. So many thanks, and any questions that you'd like to add, you can ask at the end of the session or email me privately at my email address. Okay, and over to you, Sophie.
Thank you very much, Nina. A really, really informative talk there. I think you've really clarified and highlighted some of the key issues that are coming out in the media, that are being discussed and becoming real major topics in concern with health these days. So thank you very much for that talk. So as Nina said, I'm now just going to run through some natural ways to optimize our health and reduce inflammation and look at the evidence for the role of EPA in inflammatory management. So we now know that cod liver oil has long been considered beneficial to health, and in fact we realise that these beneficial things within the cod liver oil are primarily the essential fatty acids EPA and DHA. But it's only relatively recently that scientists have become to realise that these two essential fatty acids have quite profound and different roles within the body, with DHA mainly being structural within cells and the brain, and EPA being much more physiological within its function in terms of anti-inflammatory, immune support, as well as communication between our neurons and within the brain. So, as I said, EPA as well as DHA are now considered the components of generic fish oils that are active and beneficial for health, with EPA being considered the major beneficial essential fatty acid when it comes to any therapeutic effects that fish oils can have. And studies looking at the role of essential fatty acids consistently show that EPA, above and beyond the concentration of DHA, is the real hit home therapy in terms of having a benefit. So high concentration EPA only trials that have been carried out are the most beneficial for a range of inflammatory conditions, and these studies generally supplement at 1 gram or more of pure EPA per day, and this is what gives us the therapeutic effects. So you can see from this list of just 16 references that I've taken off PubMed, this really highlights the point that Nina was making, that in this day and age, almost every chronic disease that we associate with sort of modern Western societies is at some point related back to inflammation. We've got rheumatoid arthritis in there, heart disease, diabetes, vascular events, airway epithelium, bone health, inflammatory bowel disease, COPD, even Alzheimer's disease, Parkinson's disease, and then right at the bottom we've got depression, and renal disease is also associated with increased inflammation. But what's the evidence for EPA as a therapy? Well, just generally, we know from studies that EPA modulates the inflammatory process much more efficiently than DHA. So although both do produce anti-inflammatory products, EPA seems to have a much more profound effect in controlling inflammation. And again, as Nina has already clearly highlighted, that it's the AA, arachidonic acid to EPA ratio, that's considerably more effective at telling us that someone's inflamed and at higher risk of disease from inflammation. Human studies consistently show that EPA, when supplemented at 1 gram a day or more, is therapeutically beneficial, and also the ethyl EPA, the isolate of EPA that's constantly used and highly used in a number of studies these days, has its own and specific potent activities as a clinical therapeutic. So this diagram just shows you a few of the activities of omega-3s and how they do modulate the inflammatory response. We can see here we've got a lipid bilayer with some membrane proteins in there. Each little red blob you can see is an omega-3 containing phospholipid. And the presence of the omega-3 phospholipids at high levels is quite key in the suppression of synthesis of pro-inflammatory cytokines, as well as a number of other pro-inflammatory molecules. In addition, having the high levels of omega-3 not only reduces the biosynthesis of pro-inflammatory molecules, but it increases the production of anti-inflammatory molecules as well. And omega-3s also have the ability to impact on the activity of transcription factors, as well as on our genes that actually regulate whether or not a cell is going to be expressed, what the cell's going to turn into, and when a cell should go into programmed cell death. So the role for EPA in chronic health conditions is becoming more and more apparent. And let's just look at some of the evidence to show why this is so important. When it comes to cardiovascular health, research has shown that supplementing with high purity, high concentration EPA actually prevents repeat cardiovascular disease events in people who've suffered from prior cardiovascular complications. As well as this, it also acts as an anti-inflammatory, which we know, a vasodilator, which basically means it helps the vessels of the walls of the blood vessels to just be super flexible and really healthy, so that they're less inclined to be damaged. Lowering triglyceride levels, as we know, is also very important, and it also just helps to prevent any risk factors that are floating around in the blood from being too aggressive and damaging the vascular walls. A study carried out in Japan looking at the EPA intervention, they took a group of people and they randomized them to receive either EPA or non-EPA supplementation, and then they looked at their coronary events from there on over a period of months to years. And the outcome of this study said that ethyl EPA is now considered by them as the gold standard for preventing recurrent coronary complications. This gold standard means that it's the best thing that we can possibly do to prevent anything from happening in the future. And a dose of 1.8 grams per day for women with previously identified high cholesterol and triglycerides is considered the optimum dose. When it comes to the central nervous system, EPA is considered a neuroactive lipid itself, and it helps to regulate all of the functions that are associated with good, healthy neurons and nerves, and all of the cells associated with those, including ion channels, neurotransmitters, the recognition of these neurotransmitters, as well as energy within the mitochondria, which are all really key for the health of our neurons and our central nervous system. EPA itself has been shown to prevent and reduce symptoms of mood disorders, as well as ADHD and autism spectrum disorders. And these studies looking at EPA with the central nervous system interaction are particularly key at highlighting that EPA in excess of DHA is really important in any supplement for a therapeutic benefit. Again, when we look at cancer, we see that EPA as well as DHA has a direct effect on regulating a lot of the genes that are involved in the natural processes that our body would use to combat the cancer risk. So we regulate stress through omega-3 and EPA, we regulate cell death as well as preventing cancer cell replication. But these studies have actually found that EPA controls the protective aspects of these gene expressions much more so than DHA does. In addition, EPA can prevent cell replication and induce cell death, whereas contrary to that, DHA has been found to, in some cases, actually increase the aggressive nature of cancer. The brain is a similar story. The stress response in the body is regulated by the HPA axis, and EPA has the ability to protect against the dysregulation of the HPA axis. And this dysregulation is commonly associated with a number of quite severe and chronic conditions, and even in the reduction of the grey matter of the brain. And once again, EPA but not DHA has been shown to reduce the symptoms of these conditions and support the brain's natural protective mechanisms. So let's look at just a few specific conditions. I'm going to take you through 3 different conditions and go into a little bit more detail about how EPA specifically can really make a difference to these problems. So firstly, I want to talk about depression. A number of double-blind placebo-controlled trials, which are considered the gold standard of trial, have been carried out looking at the role of omega-3 in depression as a therapeutic. And unfortunately, there have been lots of confusing and conflicting results, which has generated quite a lot of controversy. We know already that EPA, DHA, and both of their metabolites have different effects in the body. And generally, EPA does show clinical benefits over DHA. And it's due to these differing and competitive actions within the body that we now also realise that considering omega-3 as just one generic nutrient group as a therapy just is not viable when it comes to looking at research outcomes. More recent studies have aimed to address this problem and have started to actually consider the independent actions of EPA and DHA alone. Key findings of meta-analyses that have been carried out to just pool all of the known studies and figure out if there's an overall pattern have highlighted that dose, the treatment regime used, and the type of omega-3 is really quite fundamental to seeing a result. Pure high concentration DHA supplementation studies have generally been negative, and this is quite in contrast to oils rich in EPA given at around 1 gram or more a day for more than 3 months, which show sustained and significant antidepressant benefits. In 2008, a double-blind randomized controlled trial of EPA in depressed patients showed that it can be, when used effectively at the right treatment regime, as good as many of the commonly prescribed antidepressants on the market. And when used in combination with these antidepressants, the level of therapeutic benefit is much greater. And it was only 2 years later that the same research group were able to replicate their findings in another study, and this study really highlighted the importance of EPA in improving symptoms, reducing cholesterol, which we know has a major impact in the stress response and can worsen the symptoms of depression, and also reduces inflammation. So the overall conclusions of the research available today are that ethyl EPA isolate specifically is a very effective combination therapy when used with an antidepressant medication that's being prescribed, but it also acts as a highly useful standalone and natural treatment with no side effects. And this has been shown to be particularly effective in previously non-responsive patients. So we think the mechanisms of action of EPA in depression are quite wide and varied, and we're yet to hone down as a group of scientists exactly which bits are most attributed to the therapeutic impact. But we know that EPA and DHA form the phospholipid membrane of all cells, but in order for them to become physiologically active, they have to be enzymatically cleaved from the fatty backbone. If we, for any reason, have low EPA coming into our diet, or our enzyme that cleaves the EPA molecule is particularly high, then this can result in the membranes of the cells becoming quite depleted and even deficient in EPA. Supplementing with EPA can reduce the activity of the enzyme directly, but it also provides the body with a preformed EPA source that can help restore and replenish any potential deficiencies that are ongoing. By giving the body an adequate supply of EPA and DHA, we are making sure they've got the crucial building blocks to maintain cells and neurons and optimal functioning of all neuron-associated proteins, including neurotransmitters and their receptors, as well as ion channels. EPA influences production and function of neurotransmitters, and this is really quite fundamental in some of the symptoms of depression. And we can see there that serotonin, being a neurotransmitter that we all associate with mood, is affected by EPA. So not only do we have these effects on neurotransmitters, but EPA also reduces the dysregulation and the activity of the HPA axis, which regulates the stress response, as well as helping to control levels of plasma cortisol. Any abnormal HPA axis activity is quite commonly seen in patients with major depressive disorder. And again, going back to this high arachidonic acid to EPA ratio, this is very commonly observed in depressed patients and also correlates quite strongly with inflammation, as we know. So the overproduction of pro-inflammatory cytokines, in addition to the other dysfunctional mechanisms within the body that are associated with depression, increase the chances of seeing any of the symptoms that are associated with depression, such as anxiety, attention and memory disorders, and sleep disturbances. And we know that cytokines have been linked and reported to as key players in a lot of conditions. They're related to inflammation, and they are considered key players in the onset of and progression of mood disorders such as depression and anxiety. The presence of these cytokines actually increases the activation of the enzyme responsible for the breakdown of serotonin, as well as decreasing the levels of circulating tryptophan. And this is the direct precursor to serotonin within the body. So it's quite clear that having ongoing underlying inflammation will play a direct role in the destruction of serotonin, which leaves the body low in levels of serotonin, which actually, even with the presence of serotonin reuptake inhibitors and other common antidepressant therapies, there's quite a slim chance of being able to recover from depression due to biochemical imbalances. So EPA also has a really important role when it comes to neurodevelopmental disorders such as ADHD. We know that both arachidonic acid and DHA constitute large portions of the structural fats within the brain, but EPA also has quite a fundamental role within the brain, but it's more to do with the functioning of the brain rather than the stability and structure of the brain. So the functions of EPA and the omega-3s within the brain include everything from modulating synaptic plasticity right through to protection of the neurons within the brain to allow for chemical and electrical signals to communicate. Both genetic and environmental factors can influence abnormalities of fatty acid metabolism, and this is quite heavily implicated in neurological disorders such as ADHD. There's various types of evidence to suggest that polyunsaturated fatty acids such as EPA and DHA are related to ADHD, and children and adolescents with ADHD consistently have been found to have low omega-3s and high omega-6s within the blood, specifically this AA to EPA ratio. And again, there's increasing evidence to suggest that these imbalances in polyunsaturated fatty acids could be either as a result of poor dietary intake or because our mechanisms within the body to convert them and produce them are just not up to scratch. So some of the research has, again, much the same story when it comes to DHA as with depression. Standalone studies, despite the fact that they're double-blind, placebo-controlled, have been quite conflicting. Meta-analyses carried out do suggest that there is an overall beneficial effect of supplementing EPA in ADHD, and this significantly correlates the dose of EPA with the effect, the beneficial effect that the supplement is having. So the more EPA, the greater the effect. In the 2001 study carried out into DHA-only supplementation, DHA levels were shown to increase within the blood, but there was absolutely no significant improvements of statistical significance in any of the outcome measures that were looked at for ADHD symptoms. A study very similar, done using very high EPA concentrated oils, found that EPA concentrations, like the DHA concentrations, did increase in the phospholipids, but the statistical significance of the outcomes were actually there this time, and we saw improvements in ADHD symptoms. A double-blind randomized placebo-controlled trial, which was published in the Journal of Child Neurology, using ethyl EPA with GLA as a supplement, reduced both behavioural and educational difficulties in ADHD children. And these were children that had previously been unresponsive to methylphenidate, which is the commonly prescribed ADHD medication, which so many parents struggle to actually see any benefit with their children. And the key point here is, again, going back to this length of treatment. It's really, really fundamental with these EPA therapies that they're used for the right length of time to see a benefit. So the mechanisms of action of EPA within ADHD treatment are quite similar to depression. Giving EPA as a supplement gives the body a bioavailable and preformed EPA source, so we bypass that delta 6 desaturase step, giving the body a good EPA hit, essentially, which just allows for any deficiencies to be sorted out and EPA levels within the cells to be topped up. Providing supplemental EPA gives the body the template to produce anti-inflammatory eicosanoids, as well as modulating the movement of chemical signals across the cells through ion channels. We've also got signaling molecules that regulate the action, signaling molecules and regulation of the signaling molecules is occurring by use of EPA as well. And EPA directly and indirectly protects the brain and the nerves from any external or internal causes of damage. So moving on to some more mechanisms of action in ADHD, EPA also has the ability to influence the production and function of neurotransmitters, which we now know play a really fundamental role in ADHD. Dopamine, for example, is quite heavily influenced by the levels of EPA within the body. And dopamine is really important in sleep, mood, attention, memory and learning, as well as behavior and cognition, which are all major issues in ADHD children. Involuntary movement as well as motivation, and the punishment and reward pathways are also symptoms that you see quite regularly in ADHD. Again, another transmitter, serotonin, there, which we associate heavily with mood, sleep, appetite, and emotions, which are often quite disrupted in ADHD children. But it's not just the brain and developmental conditions that are affected by these poor and low levels of EPA. We also see a benefit of EPA in joint and bone health. So osteoporosis, as I'm sure everyone is well aware, occurs generally later in life. It's a condition where bone mass begins to reduce as the resorption of bone minerals overtakes that of bone mineral laydown. So the formation of bone actually reduces and the resorption increases. Most of our bone is formed in the early years, from childhood through to the sort of mid to late 20s, with peak bone mineral density being reached at about 30 years old. After this point, we then start to see, as I said, an increased breakdown of the bone minerals, and the body starts to reabsorb those, and there's a much less prone, our bodies are much less prone to lay down minerals and keep that turnover of bone happening. We know that dietary and lifestyle factors can positively influence the degree and the rate of bone loss. We're all constantly being told that we need our calcium and that we need our vitamin D. But cytokines are actually now heavily implicated in osteoporosis risk. And this goes back to their role in cell differentiation, because cytokines actually help to program the cells and tell them where to go and what to do. So with high levels of cytokines, we're interfering with the changes in cells as well as increasing inflammation. The rate of bone loss by the osteoclast cell resorption is actually directly mediated by the level of inflammatory cytokines. So you can see that having that constant inflammation underlying there with high levels of cytokines increases the rate at which we're losing bone mass. Fish has been attributed to a better bone mineral density, and this is, surprise, surprise, related to the omega-3 content. And the study looking at osteoporosis that's been ongoing and lots of evidence is coming out of it now is called the Framingham Osteoporosis Study. And this actually suggests that people who are consuming 3 or more portions of oily fish per week have a greater mean baseline bone mineral density than those who consume less than 3 portions a week. So it's quite profound to realize.
Hello?
Sorry about that, ladies and gents. For some reason, despite using the same internet connection, I just got kicked off, and Nina didn't. So I've run into the other room and made sure that I'm back. So can everybody now hear me? Yes, good. All right, I'll just finish on Nina's computer, and then we should be all right. We're nearly there, not much more to go. So we can see that fish is actually really quite fundamental, and omega-3 and particularly EPA seems to have a huge role in so many conditions, right from mood disorders through to the development of the brain and the brain functioning and our nervous system functioning, all the way through to our joints and our bone health. And this is again due to the actions of the polyunsaturated fatty acids in chemical movement throughout the body's and the bone's ability to absorb and keep hold of any calcium that needs to be deposited into the brain. Sorry, the bone. The reduction of the cytokines also, by the mechanisms of EPA, which we know reduces inflammation, increases calcium absorption, as well as increasing the level of calcium within the bone and the bone density. And actually adding in gamma-linolenic acid as the anti-inflammatory omega-6 that Nina spoke about earlier also helps to preserve bone density. And both EPA and GLA combined increases this bone density retention even further. So just going back to cancer, we're now seeing that in a number of studies, the AA to the EPA ratio is becoming such a vitally important messenger in telling us the level of risk that we're at. And we can see from this study just here that in both colorectal and breast cancer, when the AA to EPA ratio was looked at in the subjects that participated in the study, their AA to EPA ratios were nearly twice that of the healthy subjects that were also included in the study. And the funny thing is that actually, if we look at the numbers there in colorectal cancer, the healthy individuals their ratio was 14-1. And if we go back to what Nina was saying earlier about the ratios and the risk associations, that's actually borderline very poor health. So even our healthy subjects are on the verge of quite major conditions, and it's the same story in breast cancer. So once again, we can really start to see why it's almost every condition associated with modern living and Western society that's really underpinned by inflammation and can really benefit from this balancing out of the AA to EPA ratio by increasing our EPA intake. So this is just a really nice slide to